Apple cider vinegar can lower some blood sugar readings, but the effect is modest and unreliable. It is neither a diabetes cure nor pure hype. Its best supported target is the rise after a starch-heavy meal. Acetic acid may slow starch breakdown and delay food leaving the stomach. That can soften a spike, yet it cannot replace diabetes medicine, repair a poor diet, or guarantee better long-term control. Vinegar forms when bacteria turn alcohol from fermented apples into acetic acid. That acid can reduce how quickly digestive enzymes cut starch into glucose. It may also slow stomach emptying, so glucose reaches the blood more gradually. The result can be a smaller post-meal rise in some people. This effect depends heavily on the meal. It is more plausible with bread, rice, potatoes, or another starch. Vinegar cannot remove glucose already dissolved in a sugary drink. It also cannot overcome a very large carbohydrate portion by itself. The evidence does not show that vinegar cures diabetes. The evidence points toward possible improvement in fasting glucose, post-meal glucose, or A1C, your 3-month blood sugar average. These outcomes are related, but they are not interchangeable. A lower post-meal reading can happen after one meal. Fasting glucose reflects overnight liver sugar release and many other influences. A meaningful A1C change requires a repeated effect across many days. Therefore, one good meter reading cannot prove that long-term diabetes control has improved. A recent review combined 7 controlled studies involving 463 adults with type 2 diabetes. Across the studies, vinegar was linked with lower fasting glucose and A1C. However, several trials had design problems that could distort the results. The A1C results also differed sharply between studies. That uncertainty changes how the numbers should be used. Earlier reviews found smaller average fasting glucose changes. A decrease can be real yet too small to change treatment decisions. Beyond that chemical effect, vinegar may still help when it replaces something worse. That replacement effect is easy to miss. Vinegar used in salad dressing may increase vegetable intake. A sour drink may replace soda or a sweet coffee. Users may also walk more, measure portions, or take medicine consistently. The final glucose change may come from the whole package. The cloudy material called the mother is often marketed as the special ingredient. It contains bacteria, yeast, and substances made during fermentation. There is no strong proof that it lowers blood sugar better than filtered vinegar. Acetic acid appears to explain most of the immediate meal effect. Gummies create a different problem. Some contain added sugar, little vinegar, or unclear amounts. Capsules remove the sour taste, but they do not recreate the liquid used in most studies. A convenient label does not guarantee the same effect in the body. Apple cider vinegar can make one meal look better, while diabetes remains poorly controlled. A smaller spike does not correct high fasting glucose, missed medicine, or an A1C far above target. The ritual feels active and natural, making treatment delays easier to justify. That delay can cost more than the vinegar helps. Another trap is normal measurement noise. Meter differences can come from food on your fingers, sleep, stress, activity, or testing time. Checking once before vinegar and once afterward proves very little. The apparent benefit may disappear when the same meal is repeated several times. Safety matters because vinegar is an acid, not flavored water. Drinking it straight can irritate the throat and esophagus, the tube leading to the stomach. Repeated acid exposure can also soften tooth enamel. Reflux, nausea, and burning often make people stop. Slower stomach emptying can be useful after some meals, but harmful in another group. Gastroparesis means the stomach already empties too slowly. It can cause bloating, early fullness, vomiting, and unpredictable glucose. Vinegar may worsen that delay and make mealtime insulin, the hormone used to lower glucose, harder to match. Large or repeated amounts may also affect potassium, a mineral needed for muscles and heart rhythm. Concern rises with water pills, which increase urine output and can lower potassium. Insulin or medicines that force insulin release can add another issue by increasing low blood sugar risk. The practical question is not whether vinegar works in any study. The question is whether it adds a repeatable benefit without creating a new risk. That judgment depends on your glucose pattern, meal type, medicines, stomach function, teeth, and ability to use it consistently. Start with the pattern you are trying to change. Vinegar makes more sense for a repeated rise after a starch-heavy meal than for unexplained morning highs. Morning glucose can reflect liver sugar release, poor sleep, late eating, or insufficient medicine. Vinegar may not address those causes. A repeatable comparison matters more than one impressive reading. Compare the same meal, portion, activity, and testing time on several days. Use clean, dry hands before checking. A continuous glucose monitor tracks readings throughout the day, while a finger meter can still reveal a repeated pattern. Look beyond the peak number. Check whether the rise is smaller, whether glucose returns toward its starting level, and whether symptoms occur. A lower peak with nausea, reflux, or delayed digestion is not a clear win. A useful habit should improve control without making eating harder. The amounts studied are commonly around 1 to 2 tablespoons daily, often diluted and taken with food. That range describes research, not a universal prescription. More is not better. Larger amounts increase acid contact and stomach symptoms without proving a stronger diabetes benefit. Using vinegar as food is usually the gentler approach. Mix it into dressing, marinades, sauces, or vegetables instead of taking a concentrated shot. Dilution reduces direct acid exposure. Rinse with plain water afterward, and avoid immediate brushing because softened enamel wears more easily. People using insulin or medicines that can cause low glucose need extra caution. The same applies to people with gastroparesis, severe reflux, swallowing problems, low potassium, or worn tooth enamel. A clinician or pharmacist can check whether the experiment fits the treatment plan. Stop and seek medical guidance if vinegar causes persistent vomiting, severe chest or throat pain, faintness, confusion, or repeated low glucose. Those are not signs that the remedy is working. They are signs that the risk has overtaken any possible benefit. The bigger comparison is simple. A short walk after meals has broader evidence and no acid exposure, replacing refined starch, increasing fiber, sleeping regularly, and taking prescribed medicine address larger parts of the glucose problem. Vinegar can sit beside those tools, but it should not push them aside. Its best role may be as food, not medicine. Add it to a bean bowl instead of taking a concentrated shot. That approach adds flavor while the meal supplies fiber, protein, and slower digesting starch. The full meal matters more than the bottle alone. Judge apple cider vinegar by 3 tests. It should target a repeated post-meal pattern. The effect should appear across comparable days. It should remain comfortable and safe with your medicines and health conditions. When any test fails, the hype has exceeded the value. Apple cider vinegar may slightly improve some glucose readings, especially after a starch-heavy meal. The likely mechanism is acetic acid slowing starch digestion and stomach emptying. The evidence is mixed and comes from small, inconsistent studies. Use it as an optional food tool, not a diabetes treatment replacement. Confirm a repeated pattern, protect your teeth and stomach, and review medication risks before daily use. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor. Huevos.